Hi, let's imagine that you are the emergency physician on shift and you come across a patient who is either being aggressive or disruptive or is drowsy or is denying certain treatment or unresponsive. And in these cases, the issue will come as to who decides what's best for the patient. Now, therefore, to help in these situations, there is the Mental Capacity Act, which is applicable for people who are 16 years and above. And there are five underlying principles to this Mental Capacity Act. Now, the underlying principles are that we should assume that the person has capacity and should be provided with all necessary help to make a decision on their own. Just because somebody makes a decision that seems unwise or stupid to you, that doesn't necessarily mean that they don't have the capacity to do so. Now, if in case you have to make a decision on their behalf, it should be keeping in the patient's best interest, and whatever option you do should be the least restrictive of the patient's liberties. There are two things to consider. It's a two-step process. You think, is there an impairment of mind or brain due to either underlying illness or any exogenous factors such as substance abuse? And second, if that impairment of mind and brain is making them unable to make a specific decision. Now understand that capacity is to be made in context to a specific decision, such as to leave the department or to accept or refuse a certain treatment or drug. So a person may have capacity to take a decision in certain regard, as to they may choose to spend their money on something but refuse a certain treatment. So decision as to what specific. And then it's a four-step process. Checking the patient understanding. So once you go to the patient, greet, introduce, and explain them the situation and your plan, and then check, do they understand? So do you understand? The second thing is, do they retain? So you can ask, can you repeat what you have told them? Then ask if they can weigh up the risks or the benefits or the pros and the cons of the decisions, and can they communicate to you what should happen.